Hello and welcome again, everyone. I'm Nuri from the Massachusetts Health Connector. I'm joined by my colleagues Nikki and Thalia, who will be presenting today's information. On the line, we also have Ashley from the Health Connector, who will be helping with questions. Together, we are here today to share information about preliminary eligibility and what it means for members or those seeking coverage. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, though, we do have some information about our presentation format. First, everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes. Then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We'll be checking questions throughout the session. And if your question isn't answered directly during the live Q&A, just know that our team members are responding to questions broadly and we'll do our best to get through them all. And after the session is over, we will also review all the questions received and we'll follow up via email if there was anything that we weren't able to get to. Also, feel free to scroll through the Q&A box as your question may have already been answered during the session. Please do not share any personal information or private health information when you ask your question, as others on the call are able to see what you write. And if you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the customer service center and instructions on how to find help from a local assister. Lastly, we are recording today's webinar, and following the session, you'll receive an email with the presentation, so there's no need to take detailed notes. With that being said, I'll now hand it over to Thalia, who will kick us off with our presentation.
Thank you, Nuri. So next slide, please. Before going through the agenda for today's meeting, we would like to acknowledge that this session is geared towards our current Health Connector members. The purpose of today's presentation is to share information on the Health Connector's annual renewal process. Before the Health Connector can renew your coverage for 2026, we must make sure that all the information that we have on members is correct. If you have received an eligibility notice or an email about your eligibility, have questions on how to update your application, or have any other questions about the renewal process, this webinar is for you. So during today's presentation, we will discuss the Health Connector's open enrollment period, recent notices and emails members might have received regarding eligibility and open enrollment, how to access your online account and application, and how to renew and change plans for next year, and lastly, where you can get help with this process. So what is the Health Connector's open enrollment? Next slide. We are the state's health insurance marketplace, and we provide health insurance options to individuals, families, and small businesses. We provide health insurance options to those who do not have coverage through their job, a spouse's job, or another source. Those who apply for coverage through the Health Connector may get help paying for their coverage. And although our presentation today will not cover this in detail, there are also dental plans available through the Health Connector that can be purchased separately from your health coverage. We get a lot of questions about vision. Vision benefits are not currently covered by the Health Connector, but some plans may offer limited vision services. For specific details about vision services, it's best to check with the carrier to see what is included in your health insurance plan. And lastly, the Health Connector offers health insurance options for small employers with 50 or less employees. If this is something that you're interested in, we host a separate webinar with more details on the Health Connector for Business platform. Okay. Open enrollment. Each year, the Health Connector has an open enrollment period where anyone looking for health insurance can shop for a plan that will begin in January of 2026. During this time, you do not need to have a special reason or event to apply for coverage through the Health Connector. If you are a current Health Connector member, during this time, you'll have the opportunity to review coverage options and make any changes that you would like to your coverage for the 2026 plan year. During this time, before the Health Connector's open enrollment period, there is a period we call the Preliminary Eligibility period, where we will reconfirm members' information to renew coverage for 2026. Current members will receive notices before our open enrollment, which begins on November 1st of this year. Slide. So as mentioned, each year the Health Connector goes through a renewal process. During this time, current Health Connector members will have their eligibility reviewed so that they can be renewed into coverage for the following year. So in September, preliminary eligibility letters are mailed out to our current members. And then from September through October, preliminary eligibility will be reviewed. In October, members will receive a final eligibility and renewal letter confirming what coverage they are eligible for 2026. In November, open enrollment will begin and members will be able to get into their application and make any necessary changes for plan year 2026. New members will be able to go into their application to shop and compare plans. And then finally, in December, new and existing members will have to make a payment for the coverage to begin on January 1st of 2026. Okay, so when you shop for health coverage through the Health Connector, you can receive financial assistance for your monthly premium one of two ways: through advanced premium tax credits or through the Health Connector's Connector Care program. Advanced premium tax credits, also referred to as APTCs, help to lower the premium amount you pay each month. These funds are sent directly to your health insurance company by the IRS. With these tax credits, you can adjust how much you would like to apply towards your monthly premium. This might be beneficial for those whose income changes throughout the year and could lessen the likelihood of owing money to the IRS at the end of the year. The Connector Care program will also help to lower your monthly premium costs using federal and state funds. Those who are eligible for a Connector Care plan will have a low monthly premium, low out-of-pocket cost, and no deductibles. If you qualify for a Connector Care plan, you will have a plan type, which will determine your monthly premium cost. These plans will range anywhere between $0 and $300 per month. Next slide, please. All right, so there have been some changes, some recent changes to the Connector Care program for 2026 due to recent federal policy changes. The first will be the elimination of Connector Care Plan Type 1. So individuals and families whose income falls below 100% of the federal poverty level, or FPL, will no longer be eligible for advanced premium tax credits starting on January 1st, 2026. The second change will be the elimination of Connector Care Plan Type 3D. So to be eligible for a Connector Care plan, you must also be eligible for the advanced premium tax credits. So the current federal enhanced premium tax credits are set to expire at the end of 2025. If they do not continue, APTCs will only be available to individuals up to 400% of the FPL. So these are a few changes that are happening in the next couple of months. If you would like to stay up to date with any of these changes to your Health Connector coverage due to the federal changes, you can click on this link at the bottom of the page and it will bring you to a page where we keep all the updates. You will receive this in an email, so you can't click it now, but it will be available to you all. Next slide. Okay, so outlined in this chart is the updated Connector Care plan types that will be available to our members in 2026. The numbers displayed in this chart are the minimum monthly premium payments for each plan type in 2025. Members might pay more than the minimum displayed if they choose a plan with a broader network or broader network of hospitals or providers. In this chart, you'll also see that the minimum premium payments for 2026 are still to be determined. The Health Connector will be having a board meeting later this month where they will make the final decision and share rate information about each carrier later this month if folks are interested. But we are also hosting a session next month where this chart will be updated and it will be available on our website. Next slide. Okay. So as outlined in a previous slide, during this month of September, next slide. Okay. Members will receive preliminary eligibility notice in the mail, and they can also log into their HIX account and see these eligibility notices. These letters were mailed out during the last week of August, so members should start to receive them soon. We ask that members please take the time to review this notice and make any necessary updates for the 2025 or 2026 period. Included in this notice will be all household members who are on your application, your current program eligibility and your expected eligibility for 2026, your current income level shown as FPL, as well as your expected income level for 2026. And lastly, there will be instructions on the next steps you need to take if you would like to make changes to your application for 2026. So on this side, you'll see an example of the preliminary eligibility notice. And in this example, you'll see that the member was previously eligible for a plan type 3D with tax credits. But since it is expected that the tax credits will no longer be available in 2026 due to the federal changes, you can now see that this person in 2026 will have a Health Connector plan, no financial help. Next slide. All right. So for our current members, if nothing has changed, your new eligibility will not begin until January 1st of 2026. As long as you continue to make your monthly premium payments through December 31st, you will stay on your current insurance plan. If you have received one of these notices, it's important to pay close attention to this letter as Connector Care eligibility has changed. Please keep this notice handy as it has your member ID and username, and it will be useful if you need to contact customer service with any questions or concerns about your eligibility. During this time, Health Connector members will also receive other materials to help members stay informed about plan changes and enrollment deadlines. The sample on this slide specifically references steps on how to get ready for open enrollment, like updating your income and sending or uploading proof of documents. It's important to go in now and make those changes because if your income is lower now, you may be able to enroll in a lower cost plan. Next slide. Our Plan Type 1 and Plan Type 3D members would have also received email communications similar to the document presented here on the left, which explains the elimination of their plan type due to the federal changes. We realized that during this time, you'll probably be receiving a lot of communication from us, so we just wanted to highlight some of this material so that you all know what to look out for, and just to help you understand if you should be taking action. And I will now pass it to Nikki.
Thanks so much, Thalia, and thank you everyone for joining us today as we step through this information. So as Thalia said, there are opportunities now if you have to make any adjustments to either your application for this current year or your application for 2026, what you're expecting to earn, or if you know that something is changing, now is the time. So on this slide, I just want to share that in Massachusetts, we have one application for both the Health Connector and Mass Health. So whether you are an existing Health Connector member or you're someone in Massachusetts who's newly applying for coverage, you can access an application for coverage through mahealthconnector.org. It's also important to note that our online application is also available in Spanish as well as Portuguese. The links are available, as you can see on the left-hand side of the screen. And again, this is one application to find out if you qualify for Health Connector coverage or Mass Health coverage. On the right-hand side, you're seeing an image of the landing page where someone could either sign in to an existing account or they could start brand new. Again, we want to stress that if you are already a member, please choose the sign in option. Even if you don't recall your username or password, there are options to help you get back into your account. It's really important that you go into your existing account so that you're not creating any difficulties for yourself within the online application later. Okay, so I know we keep talking about updating income and keeping your application up to date. And it's really important. And we want to just stress that by doing so, it helps to make sure that you and your family get the right amount of help paying for health and dental insurance. You also will have a lower risk of owing money to the IRS when you file taxes the next year. And remember, when we talk about advanced premium tax credits, if you are someone who qualifies for them, but you know that your income fluctuates, it goes up or down, you might consider changing or adjusting, decreasing your tax credit. And you're able to do that from your online application. And the reason people do make those adjustments is to help ensure that at tax time, they're not owing any unexpected dollars. Another item we like to remind people about is sending in any documents that they owe. If you do owe a document, let's say a proof of income, remember it is required within 90 days to help avoid issues as you're going forward. Now, when you're making changes to your application, we really just want to stress that you're making those changes in the right plan year. So if you have changes that apply to your 2020, 2025 application, you want to make sure that's where you're making those changes. If the information is going to remain the same for both years, you could update your information for 2025 and then simply apply the same change to 2026 before resubmitting the application. So on this slide, we just have some more detailed steps for you on how to make changes into the application. So it's really important that you sign into your online account, and then you're going to see a dashboard, and I'll show you what that looks like. But you want to choose report changes. And again, you may need to choose which year's application to change. If the change has already happened or it's going to happen by December 31st, remember you need to update the current year's application. If you are expecting the change to start in January of the following year, then simply just update the next year's application. Again, when you are in this screen, you're going to click the Edit Application button, and it will take you to a page that says Change Your Information. And we're going to just look at that so you have a little bit more context as to what you may see. So this interface has fairly recently changed. So again, just want to make sure you feel comfortable with what it looks like and what to expect when you get there. Also, when you get the presentation, you're going to receive, the presentation plus all the links that are included in it. So you can go to some tooltip pages on our website. So for example, we have a whole page dedicated to helping somebody update their income, step-by-step instructions. All right. Now let's talk a little bit about renewing or changing health plans for next year. All right. So as the Leah stepped through earlier, there are a set of activities that lead to a final eligibility and a renewal. So let's assume someone has received a notice for coverage and, they've received a preliminary eligibility letter. And nothing has changed for them. And if they are looking through that letter, nothing has even changed with their plan type. So let's just say they're like, all right, everything appears to be smooth sailing for me. That individual will continue to be eligible for a plan the following year. So what will happen is in October, individuals will get a final eligibility and renewal letter sent to themselves. And that begins in October. Open enrollment begins on November 1. And then if somebody is expected to pay a premium, they'll need to make that premium payment by December 23rd for coverage, which begins on January 1st of the following month. So when somebody gets their final eligibility letter, it's going to include information on their health plan name, the premium, which is the monthly cost of that plan. If they're eligible for any advanced premium tax credits, that is going to be displayed as well. And just know that the Health Connector, in order to renew someone into coverage, has to follow a set of guidelines to do that. So that's how the decision gets made. As the Leah has said, and I've said, open enrollment. So if somebody wants to consider changing into a different plan, open enrollment begins on November 1st, and that's when they're going to be able to do that. And remember, coverage begins on the 1st of January. If somebody needs to pay a monthly premium, that payment is due on December 23rd. On this slide here, I just wanted to show our renewal webpage. So whether somebody is newly applying or if someone is an existing member, you can go to mahealthconnector.org/renew. If you go there now, this is the screen that is going to appear. But know that on November 1st, you will be able to see a number of quick links to get you through this process, and you'll see a timeline to remind you of important deadlines. Now, we realize that we're sharing quite a lot of information with you, so you may be wondering where you can get some assistance with this overall process. So getting help is available in a couple of different places around Massachusetts, and this enrollment assistance is free. So whether you are seeking help through the Health Connectors Customer Service Center, or if you're going to a community partner organization in Massachusetts, again, this assistance is free and folks are there to help you. For customer service, our number there is 877-MA-ENROLL, or rather 877-623-6765. Our TTY number is 711 for people who are deaf, if someone is hard of hearing or speech disabled. If you are looking for information about our hours of operation, days, especially during open enrollment, as we have extended hours as well as additional days where we're able to support people, you would want to go to the Health Connectors website and navigate to find the customer service call center information. In addition, during open enrollment, we schedule local events across the state. So that's something if you'd like to check that out and see someone in person, you can also check out our events page. Now, on this slide, I'd like to talk about our community partners a little bit more. So these are individuals who are trained and certified by the Commonwealth as navigators or certified application counselors. And these people speak many languages, typically the languages that are reflective of the community in which they are working. And they can help you from the time that you apply all the way through enrollment, or if you're an existing member. So let's just say you are a Health Connector member who's, you've received the preliminary eligibility notice, and you're wondering, all right, what should I do now? I was a Plan Type 1 member, or I was a Plan Type 3D member, and it doesn't look like I won't be able to receive any help paying for coverage. These individuals can help talk this process through with you. They can answer questions about eligibility. They can help you update your application. If you need to make a payment, they can also guide you in doing that. So truly, there are people here to help you across the state. And if you're looking for help in a particular language, if you go to our tool, the link to get free help near you, you'll be able to enter a zip code and locate some assistance, hopefully close by. Now, these folks typically are able to help you in person as well as over the phone, or if you would like to do a virtual, like a Zoom call with them, a virtual call, they can work with you to find the way that is going to be best for you to make any updates and changes to your application as you need to. Now, at this point, I feel like we are ready to take some questions. I just want to look to my colleagues, Thalia, Nuri, and see if there's anything else we wanted to add before we go to questions.
Not sure if Thalia has something to add. I know that we have been getting through several questions in the Q&A box, so thank you to everyone who has been submitting those. I do see one individual raise their hand. Just a reminder, we are using the Q&A box. Just one second, Nikki, as I review some of these that are still remaining. I think overall we have received some questions about income and what to report for eligibility purposes. So I don't know, Nick, if you're able to just speak at a high level about income. Besides that, we have seen several folks just asking specific questions about reporting changes to their accounts and when they should do that, etc.
Okay, sure. So let's talk a little bit about income, and then we can share within the email that we send back to you. We'll share some additional information and links so that you can go directly to our website and you can see the different incomes that you should be reporting versus things that you do not need to report on. So in terms of things, as examples, things that you want to report are income that you receive from a job, income you receive, let's say you may receive rental income, let's say you work multiple jobs, we would want to understand the wages. Now, for those people who may have income that fluctuates, you can incorporate, you can add information onto your application for what is known to you. And I think it's worth noting that if you do not, if you're not sure what your income's going to be, or let's say you're working, your income is going up and down, you can come back into your application and you can make adjustments. So this is not a one-time enter your income. Enter your income, and it is not changeable. Entering your income is something that you can, or adjusting your income, pardon me, is something that you can do throughout the year. And it's something that you should do to help make sure that you are getting the most help that you can, and also getting the least amount of tax liability at tax time.
Thank you, Nikki. I know that you guys reviewed some of the changes that are coming up, and I think folks are trying to figure out what type of coverage they have at the moment. Not sure if you're able to provide additional steps to guide people and determine, if they are being impacted or
Sure,
would
that's
seek
a
coverage.
great question. So there are many ways that somebody can check and see what, if they're in a Health Connector plan, if they are in a Connector Care plan, specifically what type of plan they're in. So the first thing I would suggest is check your email, see if you've received any emails from the Health Connector. The Health Connector is required legally to send notices to you via mail unless you've selected paperless. If you have selected paperless, you could check the member portal to receive your to review your preliminary eligibility notice. When you look at that notice, you will see as Leah had mentioned, we showed you what the sample notice looks like. It shows you not only your information, but any other people who are on your application. It'll have that information listed there. There is a chart, and I can go back to the chart. Excuse me for switching the slides this way, but I just want to make sure. Okay. So there is a chart here that is going to show your name, date of birth, what your current program eligibility is based on the information that the systems know about you, what we expect your eligibility to be for 2026, as well as current income range and expected income range. So again, if you aren't sure, like what type of Health Connector plan you are in, this is one way that you can find out. Another way is by simply logging into the online application. And I believe there's an application summary page, and you can check and see what type of plan that you're in. Nuri, does that help? And maybe it's also worth saying that if you just are struggling with just this particular part, you can also pick up the phone and call customer service and just ask them to, they'll validate, they'll verify your information, they'll make sure that you are who you say you are, and then they can help. They can either help guide you online and show you where to get this information, or just tell you um, what your eligibility is and what your expected eligibility is for 2026. I hope that helps. And assisters. I'm sorry, I feel like I should be saying and um, navigators can help you with this information. Certified application counselors can also help you. What's important to note is these people are only able to access your account with your permission. So again, they are here to help you.
Thank
Dalia,
you, Nikki.
anything else you'd like to add? Dalia or Ashley? Maybe I should.
They're currently answering questions for folks that I was actually going to ask live.
Okay.
I have seen this question come up a few times now, though, Nikki, with regards to notices that are being sent out. I guess individuals are wondering if they're also able to access them on their account. But Dali, I just saw you came off mute, so I'll allow you to jump into if you wanted to ask anything else.
Oh, I was literally just answering that question. I was gonna say, yes, they should be available on your Hicks account as well. Um, I wish that we could share a screen and show you exactly where to find it, but it should be available on there, correct, Nikki?
Yep. So when you go back into your application, you actually are going to, and I'm so sorry. I'm not going to give you the exact steps, but if you go to our website, you can find the exact steps. We'll make sure to share that link in the follow-up email. But essentially, you're connecting to your portal, and getting comfortable with going to your member portal is really important because in addition to seeing any notices that we send you, if you're looking for a copy of your bill, if you're looking for a copy of your premium bill, that is also there. If you are trying to get a copy of tax forms, That's also there. So this is a great repository, a great place that you can find all of this information in. So yes, once we send these mailings out to people, all this content is also available in your online account.
Awesome. Thank you, Nikki. We have a couple of questions here in the Q&A. I think we have enough time to just go through them.
Sure.
So someone's asking about the process to apply for Mass Health Premium Assistance.
Sure. So this session is really geared towards Health Connector members. However, if you are interested in Mass Health Premium Assistance, I actually would suggest that you contact the Mass Health Customer Service Center. If you do a quick search on mass.gov, you'll be able to get that information. And if I'm not mistaken, there is a whole separate landing page that describes premium assistance and I think might even give you a more direct phone number to reach out to the Mass Health Premium Assistance Program. And they can help you with that. And as I had said before, this application is the application for both Health Connector and Mass Health coverage. So this is the one online application for our programs. But premium assistance is slightly different. So I would recommend that you review that information first before you take any additional steps.
Thank you, Nikki. Moving on to the next question. It looks like someone's interested in knowing, just speaking generally about Health Connector premiums and how they may increase or change due to federal changes.
Yeah. So thank you for asking about this. So as Dalia had stepped through, we are expecting, due to those two changes to the Connector Care program, we are expecting increases, right? Actually, I shouldn't say due to those two changes. I shouldn't say that. Due to federal changes as well as the market, we're expecting some changes. So for individuals who are in plan, who were in plan type 1 this year, and then looking to coverage for next year, if they don't have any changes to their income or to their household or any other aspect of their application, they could be looking at enrolling into coverage without any type of financial assistance, which is a significant difference. For individuals who are still eligible for Connector Care plans as well as advanced premium tax credits, again, we're looking at what you will be seeing following the September board meeting is, you'll be seeing updates to the monthly premiums that you will be paying. It's really important to remember for a plan type, for Connector Care members that we always have a lowest cost plan option that members can change to if they're not already enrolled in that. But we really caution people as they're considering making a change to really look at their providers, if there are any providers that they want to keep prior to making a change. Make sure that they review the new plan that they're interested in, their provider list. And then for those who are in Connector Care plan type 3D right now, again, if we do not receive, if the enhanced advanced premium tax credits are not extended, as we're expecting that 3D will be eliminated, and therefore those individuals will no longer be eligible for the Connector Care program. So I'm hoping that helps kind of at a high level, just reiterate the different kind of ways in which things are shifting for Connector Care, as well as us just learning more about what the overall market changes will do and how they will impact the premiums in September. That will be shared in September.
Very helpful. Thank you, Nikki. And then when it comes to reporting changes generally, there may be some confusion here that hoping you can clarify. If there's a change happening in 2025, just going to give an example that might not apply to 2026, how should individuals proceed?
Yeah, so if there is a change, let's say to the application right now, you would just enter that. You don't have to apply those changes to the following year. So let's just think of an example. So um, maybe for this year, you know that you're going to take on additional hours. So you're looking ahead to the remainder of the calendar year, and you have been asked to take on additional hours at your work. So you could come back in and report those additional hours for this year. But for plan year 2026, you are not going to apply those changes because you're not getting that extra overtime. You know you're going to, or you could be making less. So remember, you could have something that is going on this year, full stop. Next year, your application, your income for next year, it is okay if that is different, whether that income has gone up or that has gone down. As a reminder, if the income information that you're entering isn't in line with like state and federal tax information that is known about you, you might be asked to provide proof, or you're likely be asked to provide proof. So if you are providing or need to provide proof of income to the Health Connector, I think it's really important to note that you can do that online. You can upload documents, or you can go to an assister or call customer service and get help uploading those proofs so that you don't have any hiccups in your coverage and you get to stay in continuous coverage with your plan. The Leah and Ashley, at any point, if you want to add in, I'm sorry, feel free. I just want to make sure I give you guys a chance.
Nikki, I will say it looks like some folks might be struggling to find their eligibility letter in their accounts. So maybe we can just, as in the follow-up email, provide maybe a few screenshots to be able to help folks navigate their accounts and locate those notices if they haven't received them in the mail yet.
Absolutely. Thank you so much for that feedback. We're happy to do that.
If Thalia and Ashley don't have anything to add, I'm happy to move on to the next question that we have here that is unanswered. And it is regarding deadlines for each month. So I guess looking
I'm
for
sorry.
reason or explanation for the deadlines of each month, Nikki.
Oh, yes, thank you. So essentially, every month the Health Connector is, well, depending on somebody's situation, they may need to enroll in coverage outside of open enrollment. So they may have a qualifying life event that allows them to get into coverage with a special enrollment period. And essentially, every month, if they owe a monthly premium, they will need to make a payment by the 23rd of the month in order for the coverage to start on the first of the following month. So let's just say, as an example, it's early September and someone loses their job and is losing their health insurance coverage at the end of this month. So they're seeking coverage for October 1. They would need to either apply online, complete the application on their own, or with assistance. If they are found to owe a monthly premium in order to proceed, they will need to pick their plan. Oh, excuse me, regardless, they're going to need to pick their plan. I apologize. But if they owe a monthly premium, they're going to need to pick their plan and make their premium payment by the 23rd of the month in order for coverage to be effective on October 1st. Now, I think it's worth noting that there are some exceptions to that rule. If somebody is in a situation where they lose their health insurance coverage and it happens in the last week of the month, we don't want to not be helpful to that individual. So if it's after the 23rd of the month and you need that coverage to start on October 1st, call customer service, explain the situation, and depending on the situation, there may be some flexibility in getting you into coverage with the carrier's approval for the first of the following month. Also important to note, is that, I've said it a number of times, individuals, when they're applying for coverage and they don't know necessarily whether or not they're going to be eligible for Mass Health coverage or Health Connector coverage. But if they apply or make updates to their account and they find that they're eligible for Mass Health, Mass Health has different starting dates and retroactive coverage rules, so that an individual might actually, you can start with Mass Health. You can start your coverage not on the first day of the month, but mid-month, second week, first week, etc. So again, Mass Health has different enrollment rules, but the Health Connector has a payment deadline of the 23rd, and all of our coverage begins on the first day of each month.
Thank you for walking us through that, Nikki. I hope this was helpful for those who are wondering. Dalia, did you want to chime in?
Yeah, there was just a question that came in about getting coverage through the Health Connector, even if your employer offers health insurance, but the cost is too high.
Yep, that's a great question. I'm glad that folks are asking about that. So typically, the Health Connector, as the Leah had explained up front, we are an option for individuals who don't have access to coverage, whether it's through a spouse, a partner, or excuse me, through an employer or a spouse or partner's employer's sponsored insurance. However, there are sometimes when somebody is looking to apply for coverage because the coverage that they are offered feels unaffordable to them. So the Health Connector follows an affordability, there's an affordability schedule and affordability rules. So when you're going through the application, you're actually asked about the offer of employer-sponsored insurance. So if you are someone who has that offer, you just need to be able to provide additional details about that plan, what the monthly premium would be, what the employer contribution would be, what you're expected to contribute. And any HR department should be able to provide you with all those details so that it can be included in the calculation to determine whether or not you in fact could get coverage through the Health Connector instead of your employer. I will say that generally speaking, many people in Massachusetts, many employers in Massachusetts do meet the affordability requirements. However, there are some that do not. So I don't want to discourage anyone. And then also someone earlier mentioned the Mass Health Premium Assistance Program. I don't want to talk too much about a Mass Health program as we're not that organization. However, it is worth investigating the Premium Assistance Program because individuals who are in certain income levels and may have to meet other requirements could in fact enroll in that employer-sponsored coverage and get assistance through Mass Health paying for that private insurance. So in our follow-up email, we will include a link to the Mass Health Premium Assistance information. I don't know if it's the same person who's asking that question or a different person, but happy to provide that premium assistance information if that could be helpful to somebody.
I think that sounds like a great idea, Nikki. It looks like a few folks are still just asking general questions about connector care and the changes and specifically plan type 3. I'm happy to ask the specific questions, or Nikki, if you wanted to touch on that again at a high level.
Could you share some, maybe
Yeah,
without PII, of course.
of course. Yep. So someone is asking about connector care 3B and whether or not that'll exist in 2026. I think others are still wondering whether or not they are in a connector care 3D plan. I think it might be helpful, yeah, to go back to those slides.
Sure, sure. And sorry, I shouldn't use acronyms like that. So when I said PII, I meant like any private information about a person. And I think Nuri at the onset, you asked people not to share any specific details about themselves because again, we just want to protect you. Um, so on this slide, we just want to show you these are specific plan types that will be available in 2026. So as we talked about plan type one, so for individuals under 100% of the federal poverty level will not be able to enroll in connector care plans. And then connector care plan 3D will be going away if enhanced premium tax credits do not get extended. So again, plan type 1 and plan type 3D are in place through the end of this calendar year. But these other plan types, individuals whose income fall within these income ranges, will be the plan types. Connector care is continuing. People in those income ranges can continue to get coverage in the connector care program. And I know this may feel a little vague as we talk about income level and I talk about FPL. If you go to the Health Connectors Resource Download Center, there are flyers that talk about the connector care program, and we translate the FPL level into an income range for you. The reason we can't point to the 2026 information just yet is we'll need to display in addition to displaying the actual income for these ranges, we're also going to want to display the lowest cost connector care plan for these particular plan types. And again, as we said, it will be public knowledge in September. Our board meeting, excuse me, is on Thursday, September 11th.
And I'm gonna plug that into the Q&A. If somebody wants to go and look at that link, just keep in mind that it is for 2025.
Thank you, Thalia. I appreciate that. And if you don't mind, if you can also plug in the premium assistance information, so the person doesn't have to wait for the email. And just for anybody who's Googling on the side, if you go to mass.gov and then within mass.gov, just search for Mass Health Premium Assistance, you're going to see a detailed web page that will give you information about the Premium Assistance Program.
Perfect. Thank you for sharing that, Nikki. Just seeing
No
that
worries.
someone is asking about applying for Mass Health and they describe their very specific situation that they're in with them and their spouse. So to the person asking that question, Nikki just shared the resource, and of course, we're happy to follow up with that information as well.
Yes, we will definitely do that.
Question for you, Nikki. Is there help available for dental plans? So I'm assuming they're asking about subsidies.
No, there are not, but there is, let's follow up on that because if I'm not mistaken, um, premium tax credits can be used to help with pediatric dental, but let's follow up and give you a definitive answer on that. But I believe the answer to that is no.
Alrighty, will do. Another question here in the Q&A. Not sure if this person can specify or add more details as to what they're referring to. But Nikki, I will mention just in case you're able to answer it.
Yep.
It says here, for members not receiving financial assistance with zero changes, what does a significant increase mean? Again, not sure in what context significant increase, maybe income, but there is someone wondering.
So I think I just want to caution folks. I think I don't know. I don't have a crystal ball as to, or none of us do, what exactly all of the rates are going to be. And as they will be announced on September 11th. In terms of our process, maybe it's just worth noting that the Health Connector is involved in this process in that each of the carriers that want to sell a plan on the state's marketplace through the Health Connector need to go through a really rigorous process. Then all of the plan designs as well as all of the rates are reviewed, and the state's Division of Insurance reviews all of the rates to from another perspective. So together, the state's Health Connector as well as the state's Division of Insurance come together and present a proposal to our board in September, and then the board will vote to approve the results so that we're able to present all the plan information on mahealthconnector.org as well as all of the rates. So I don't really want to comment on what an increase might be, but rather just hold off and say, tune into the September board meeting. You will get final results. You'll see what that looks like. And again, depending on what changes happen, in terms of, let's say you're in an unsubsidized Health Connector plan and you're considering moving into a different plan based on what the results are or what an increase might look like for you. Remember, it's really important to shop. This is the time to shop, and you can choose to shop and move into a different plan. You are not locked in for plan year 2026.
Perfect. And for those who are interested in watching the board meeting, it'll be live streamed on YouTube, so you can look for the Health Connector YouTube channel, and it'll be available to you all. Someone is asking about implications for individuals who are self-employed. Not sure if we're able to speak to that, Nikki, at this time.
Um, I'm just trying to think of any general statements I can make about people who are self-employed. Welcome. Apply for coverage. We're here to help you with health insurance. You are going to need to submit proofs of your of income, and I'm sorry that the words are escaping me right now because it's specific type of proof if you are self-employed that you're going to need to share. But yes, just like any other individual, if your income that you are stating for plan year 2025 or income that you're projecting for plan year 2026 doesn't match records, both federal and state data sources, you're going to be asked to provide proof of income. So hopefully that helps. And then if somebody doesn't mind popping the Health Connector's income page into the chat link, that would be super helpful as well. So people can take a look and see if there's a particular income type or question that can be answered that way. We want people to know where to find the resources as well.
Alrighty, and then I know we have just 2 minutes left. We're almost through all these questions here. I am seeing one from an attendee that says, is there a time frame as to when a decision will be made regarding the elimination of enhanced premium tax credits?
We'll get back to you on that. Unless Ashley, I'm not sure if that's something you can speak to in terms of timing.
Yeah, I just want to make clear that APTCs are not going to be eliminated altogether. That is not on the table at this moment. What is on the table is the enhanced premium tax credits, which make advanced premium tax credits more generous and also make it so that there's no income cap on APTCs, which is currently in place under current law. That will be going away at the end of this year, so they will not be available for people above 400% of the federal poverty level for 2026. So that's current law. There is always a chance that Congress could act on that and extend those enhanced premium tax credits and that generosity. But unfortunately, we don't have any information at this time that we can share about that decision.
Thank you so much, Ashley, and thank you for clarifying that because I don't want to unnecessarily frighten anyone as it relates to advanced premium tax credits. Thank you.
Yes, Ashley, thank you for clarifying. My mind automatically read enhance.
I did
We're
too,
going to
but I
talk
just
about
wanted
that
to make
next.
sure that
Yeah,
was very
thank
clear.
you. Appreciate
Thank
it.
you.
Alrighty, well, we are at time, but Nikki, Ashley, Talia, I want to welcome you guys for any final parting words for those who are still with us today.
No, just a big thank you for joining, and we hope that this was helpful information for you. And if you have any questions, please reach out for additional assistance to look at your case. But we'll send you a follow-up email with a link to the presentation, the recording, and additional links with to questions that you were asking about. So thank you all so much for your time. And Nuri, thank you so much for helping us facilitate today.
Of course, well, thank you all for joining today's webinar. Thank you, Nikki, Ashley, Talia, for all of your help. And on behalf of the Health Connector and sisters and everyone else, we wish you all well. Enjoy the rest of this day. Take care, everyone.